Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, January 19th, giving you the update from Albany Med. All right, let's pop open the first graph here. Fred, this is hospitals in the capital region, 8 counties. Currently, there are 534 people in the hospital with COVID. Fred, on this morning's call, I think you were using the word plateau. If you look at that graph,
Yes.
It's a little hard to see because it's a big graph, but the numbers over the last week or so are definitely not climbing.
That's right, Dennis. I think we're hovering around 600 and probably even closer to 10 days now we've been there.
And as we talked about in last week's video, that is what was predicted based on the modeling.
That's right.
as far back as three weeks ago.
That's
People
right.
about that.
That's right.
Let's pop open the next graph here. So this is admissions and discharges to the medical center. You can see, Fred, and you know this, of course, we've had a couple days with a significant number of discharges.
That's right.
As many as 20, actually, in one of those days.
That's right.
Still no flu activity, and we
flu.
think that's probably going to be the case now for a while. We're not hearing about it anywhere in the region.
Very scattered cases here and there, but not much at all.
So the last graph here is the current morning census at the medical center. And I don't always say this, but let me be obvious. This is just COVID. Our morning census is about 700 people. But in the hospital, 159 with COVID, 126 on the floor, 33 in the ICU, 9 on ventilators. So Fred, 9 on ventilators. At one point, we were down much lower than that.
That's right.
We've also been higher. But predictably, as the admissions go up first, you see that, then you see the ventilators go up, and then sadly sometimes you see the mortalities.
Mortalities follow.
So nine on ventilators, not surprising to us.
That's right. Now that does put us into tier 3 for the ICUs.
Okay.
The number of cases and the number of vented patients.
So let's talk about that. Tier 3, obviously we talked last week about the PACU ICU.
That's right.
Another location. Talk about that a little bit.
So we opened it last week, and we've been going up and down, but on average 4 or 5 patients in that ICU. Those are non-COVID patients, so primarily people coming from our SICU, our surgical intensive care unit. So it's really helped decompress.
And med-surg tier, where are we with med-surg tier?
We're tier 4 still,
4.
And we've been there for a number of weeks now.
We've also talked in the last week or so about how when people come through the emergency department and they're going to be admitted to the hospital, that we test them for COVID.
That's right.
How is that going?
So Dennis, it turns out we were testing probably 70% of the admissions already,
Right.
so now we're testing 100%. We've identified a few asymptomatic from a respiratory perspective kinds of patients, turned out to be positive. So it's been helpful.
And so by knowing that they're COVID positive will allow for the proper placement.
That's right.
away. Excellent.
That's right.
Fred, an article recently published in the British Medical Journal, it's a very prestigious medical journal, talked about, I'll use the words durability. You'll explain it better than I will, but it has to do with if you've had COVID, how long your antibodies hang around?
That's right, Dennis. And really, they were talking about whether or not you get reinfected.
Okay.
And so that ties back to the durability of your immunity. So it turns out it's very uncommon. There are only 31 confirmed reported cases worldwide. Worldwide. Now, that's probably an undercount, but still I think it underscores how uncommon it is to get reinfected.
So this would be someone who had COVID, fully recovered, and then got COVID again.
And Dennis, even that is potentially suspect because you could have reactivation.
Right.
And the only way to determine that it's a new infection is to do genetic testing on
Right.
the virus. In this article, they also talk about a study where 11,000 healthcare workers in Britain were positive during their first surge, so they had
Right.
COVID. In the second surge, none of them got
Wow.
COVID again. So that would suggest 0 reinfection in 11,000 people. So very, very uncommon. So it seems over a reasonable period of time, 6, 8, 10 months, your immunity lasts.
So it's a perfect segue into the next topic, which is the vaccine. So there's 2 ways to build up immunity. One is natural immunity. You get the virus, you build up immunity, it protects you.
That's right.
The other way, of course, is through vaccination. Let's talk a little bit about our workforce first. We get vaccine, Fred. It's given first from the federal government to the states to the hospitals, in our case. Of the vaccine that we have received for the members of our workforce, we've used 100% of it.
That's right,
So
Dennis.
we have no vaccine that we're sitting on, and that's first dose vaccine. And
Correct.
every single person who got a first dose, there'll be a vaccine coming for that second dose.
That's
and
right.
in fact, that's even happening today.
That's right.
So that's great. Now let's take a different question. what percentage of our workforce has been vaccinated?
So Dennis, that number is 81%.
Wow.
So 81% of people who work here at the medical center have been vaccinated first dose. We're somewhere in the 30% range for second dose, but that's going to pick up in the next week to 10 days as we vaccinate more people.
Let me ask you a couple more questions. So if I'm out there in TV land and I want to work at Albany Medical Center someday and I think, wow, I haven't been vaccinated, but if I go to work at Albany Med, are they going to have any vaccine left for me?
Yes,
So
absolutely.
new employees in the future.
New employees are going to get vaccinated.
Great.
Yep.
And then you mentioned 81% have taken the vaccine, 19% have not.
That's right.
What are we doing about that 19%?
So Dennis, we're actually putting together a survey. We want to ask them, would you be willing now to get vaccinated? And if not, we want to kind of understand why. That they're not going to get vaccinated, what their concerns are, to see if we can address those concerns. I'd like to get us as close to 100% as we possibly can. I think it's for the health of our employees and also for the health of our patients.
All right. And again, for those individuals who are among those 19%, if they change their mind, we'll get them scheduled and they can get that taken care of.
And hopefully that survey will be ready sometime this week and we'll go out to them.
Good, good. And then second dose vaccines are continuing. It's a great reminder. The time in which you get your second dose is basically dictated by when you got your first.
That's right.
Pfizer or Moderna, same flavor if you would. Whichever one you got the first, you get the same for the second. And the timing is prescribed.
And so today starts the Moderna second doses. So that's why I'm dressed this way. I have a short sleeve shirt under here. So I got my second dose.
You got your second one?
I got it this morning. Yep.
So Fred, some people have said after getting the second dose, they get muscle ache. Some people have felt fatigued. Some people have run a low-grade fever. What's our advice to people if they get those symptoms?
So particularly if you get a fever, stay home.
Right.
Take some Tylenol. If it goes away in 24 to 48 hours, it's just related to the virus. You don't need to do anything.
Right.
If it persists beyond 48 hours, you probably need to get tested because maybe you actually do have COVID.
Okay.
Not from the vaccine,
Right.
but it was brewing already.
And so we're watching those numbers very carefully.
Yes.
Finally, Fred, 81% when compared to the region, to the state, to the nation. These are really incredible numbers. We should be very proud.
Yes, I think our workforce has really responded to the call to get vaccinated, and it's just a tremendous effort. Thank you all very much.
So the last topic is not about COVID, but it's about COVID because everything's about COVID. So the Albany Prize. We've been very proud on this campus now for 2 decades to have the Albany Prize. This was started by Marty Silverman back with Jim Barba. Vince Vidal was involved at the beginning. This is one of the most prestigious scientific prizes in the country.
That's right.
And I forget the exact number, but a significant number of people who've won the Albany Prize have gone on to win the Nobel Prize in medicine and other things. So interestingly, there's a couple people who have received the Nobel Prize that are in the news these days. In 2001, Dr. Fauci won the Albany Prize.
That's right.
And so we're very proud of that. But there's another one.
That's right. Eric Lander, who is at the Broad Institute at MIT, I think it was 4 or 5 years ago, won the Albany Prize. And he's just been named, I have to read it, the Director of Office of Science and Technology Policy in the Biden administration. So he's going to help to bring science back to bear on how we deal with some of the issues that the country's facing.
All right, very good. Well, congratulations to them and to the selection committee, which has obviously picked some pretty incredible winners.
You know, I sit on the pre-selection committee,
you do.
And it's fascinating to read what people are doing that get nominated. It's just amazing.
Their resumes are about as thick as a phone book.
They are. They're always summarized by the nominator.
Right.
And to read those 3, 4, 5-page letters, it's just, my God, what a tremendous group.
That's great. All right. So we'll be back again on Thursday, and I'm sure we'll have some updates then.
Yes, we will.
All right, very good, Fred. We ask that you once again please take care of yourself, take care of each other, and we'll see you in 2 days.